Welcome to Agile Coaches Corner by Agile Thought, the podcast for practitioners and leaders seeking advice to refine the way they work and pave the path to better outcomes. Now, here's your host, coach, and Agile expert, Dan Neumann.
Welcome to this episode of Agile Coaches Corner. I'm your host, Dan Neumann, and our goal here is to bring you Agile topics in an approachable way. And of course, the opinions expressed here are those of the participants and don't necessarily represent those of Agile Thought, any other people, or other organizations. And I'm really excited to be joined today by Dr. Jeff Thompson. Dr. Thompson is CEO Emeritus at Gundersen Health System. He's a pediatrician and the author of the book Lead True: Live Your Values, Build Your People, and Inspire Your Community. Jeff was the CEO of Gundersen Health Systems for 14 years. You were responsible for improving quality, lowering costs, and rapidly advancing technology. And you had a staff of, as I understand, about 7,000 folks. You served hundreds of thousands of patients, and you were the steward of spending about $1 billion of the community's money. Jeff's long experience as an intensive care pediatrician, senior executive, showed him how leading from one's values can affect tremendous, lasting change. And that alignment and leading with values really resonated strongly with me in the Agile community. So thanks a ton for joining, Jeff. Really appreciate it.
Well, thank you very much for having me. I really enjoy talking with folks about values-based leadership. I think it's applicable to healthcare, of course, and business in general, communication industry, politics, building our communities as a whole. So I like talking about it. I think it's a great opportunity for both young and more experienced leaders to rise up and build a better way forward.
Agreed. So what I liked about the book and the values-based leadership, or living the values, is that there's a really strong encouragement to make the values explicit. Obviously, every organization has values, and sometimes you can tease them out by the behaviors they reward. But what I liked is how you made them explicit at Gundersen and with the role you played.
I think that was a key part of how we made it work for the whole organization, that you have to have the courage to say, this is what we're about, and there's who we're about. And I think for staff that really want to exceed, and you can start sorting people pretty early, if you give them a clarity on what the purpose is, where we're going, what we're about, what we're going to stand for, that gives them a way, where we're going, and then the value set tells them how we're going to get there, how we're going to treat each other, how we're going to make decisions. If you take that and have, here's where we're going, it's not going to be mediocre, it's going to be excellence, it's serving the greater good, it's not just our own well-being, and then say, and here's how we're going to treat each other as we serve this bigger purpose. You now start inspiring people within your organization, but you also start attracting people from outside who say, you know what, that's an organization that I can lean in on and really make a big difference. So our hope was to be clear about that and then engage most of the 7,000 to pull on the oars with us in that direction.
Yeah, making that purpose known. And you talked about not just the financial well-being of the organization. Obviously, that is super important as well. But the purpose beyond the money. And in healthcare, I would hope that's pretty obvious, but maybe it isn't for a lot of organizations, especially as you get outside of healthcare. What's the purpose?
Right. It's really not. I mean, the purpose is, and the values are clearly written on the walls and on the website. But that's not how everybody lives. Whether you're in a healthcare organization, a business, or in government for that matter. There's some fabulous people in all those places. There's also some people that are pretty short-term thinkers and pretty narrowed in their focus. And our argument was, you want to compete for the long term. You want to get the brightest and the best. There's a lot of great people out there who want to serve a higher purpose. And it doesn't mean you don't have good finances. I mean, finances, I said many times, finances were never the goal. They were the tool, an important tool, a critical tool, but they're just a tool. And when you stand in front of the staff and say, do we have to have decent finances? Sure, all you want to get paid, you want to have benefits, you deserve to get paid, you deserve benefits. But we shouldn't take any more out of the community than we absolutely have to. to be fair. And that means becoming more efficient, becoming more thoughtful, partnering with people across the spectrum of business and industry and education and government. And so you build a steady drumbeat of serving this other purpose, but in a disciplined way. We have to hit our quality marks. We have to hit our service marks. We have to be financially sound. And it turns out, while focusing in this way, we had the best finances in 120 years of the organization, but it was never the main goal. We grew the most we had in 114 years, but it was never the goal. They were just tools. They were tools to serve the bigger mission.
When you became CEO, was this kind of a new thread then? And was getting alignment around purpose and around those values something that was difficult? And if so, maybe what were some strategies that folks might learn from for getting good alignment around purpose and values?
I think one of the most important things was we had a lot of good people before I became the CEO who were doing terrific work in the organization. The key, I think, was to be really clear about it and consistent on the message and write it down and put it up there. So you have the courage to say, here's what our purpose is, here's what our mission is, here's what our value statements are. The mission was distinguish ourselves through excellence, patient care, education, and the well-being of the community. That means if you came into me and said, well, we're at the 50th percentile for our outcomes, I would say, that's not excellent. That's in the middle. Do you tell half your patients that they're going to get less as good a care than most of the people in the country? I mean, you aren't going to say that. No, we deliver great care. So, well, the measures say you're only in the middle. We need to do better. We can do better. Measuring yourself against your mediocre past isn't greatness. It just, you're a little bit better than your mediocre past. You're probably still mediocre. So we said here, and we applied it consistently across everyone. So one of the key pieces was a code of conduct that would apply to everyone in the organization: CEO, environmental services worker, doc, nurse, didn't matter. Business leader, didn't matter. Everybody had the same code of conduct. Here's what the organization would deliver to you, and here's what you deliver to the organization. It was printed on everything. It was put up on the wall. It was put up right next to the strategic plan that said, here's our purpose, here's our mission, and here's our values. So it consistently reinforced this principle. We are outward facing. We're serving the public. We're going to take care of each other, and that's a way we're going to take care of our patients and our community. We're going to be disciplined in that approach, but it's going to be about excellence in outcomes, not short-term, did you hit this little mark, little mark, little mark. Now, behind it, do we have a system of working on that? Yes. But the answer to your question, the keys were to have the courage to put out there, here's where the organization is going and here's what we're about. Completely public, put it out. It's by every desk. It starts every presentation that I made. And then the code of conduct, here's how we're all going to behave. Now, I just gave us some leadership training at a university not long ago. And we had great fun. It's students and faculty and senior leaders from the university. And fortunately for me, I'm quite excited about it. Maybe not for the leaders of the university, but the students got done and said, Dr. Thompson said had a code of conduct for all 7,000. We have a code of conduct here at the university for the students. How about the faculty? How about the deans? How about the chancellor? How about the rest? How about if we all have the same? That's a good idea. So now it's gone from 50 students making noise to 300 students making noise. So I think I've caused quite a problem there. But but it's quite good fun. And this is a consistency. If you the more special and protected the senior leaders, the more unspecial and afraid the other members of the staff are. So the more you separate, the more distance becomes, and they're less likely to believe your emails or your talks in front of them. So you have to have this code of conduct that applies for everyone. That is a way that you can move forward and affect the whole culture of your organization, even when you're not in the room.
Yeah, and I like that. And for those companies that are going to hang them on the wall and then not live up to those, that breeds a culture of hypocrisy pretty quickly, and people will sniff that out. And I think you called that a get by culture in one of our chats.
Yeah. We added one of the things we did is worked very hard on advanced care planning here for seniors. We thought it was a respectful way to treat seniors. Give them the care they want. They want more care, give them more care. They want less care, we give them less care. We give them the care they want. They get to direct their care in the last years of their life. The discipline part, so that's clear and courageous. Yes, we're gonna make this stand. Is it in many parts of the country, would that cost us tens of millions of dollars? It did, because of the revenue, because most of the time seniors, when they get to direct their own care at the end of life, choose less care. So there's a whole lot of revenue that we weren't going to get. But remember, it's not about the money. It's about the well-being of the staff, and the well-being of the patients. And so we chose to do that. The follow-through is very important. We had to make it available, these directives available. We have to have a system to follow through. We have to have quality improvement to make sure we're really following. We had to have hospice and home care. The problem was some organizations just did the conversation in the advanced directive. I was speaking at a major university out east, very well respected, do a lot of great things. And they said they were very impressed that we had 95% of our seniors had their advanced plans and available and were followed in the last 2 years of life. That was the highest anywhere in the country. They said, well, we got up to 90% of our seniors had advanced care plans. I said, that's great. And we follow them 16% of the time. I said, that's terrible. You're making a promise and then breaking your promise. She says, oh yeah, it's a complete disaster. It's terrible. I feel bad about it all the time. It's the same way inside an organization. If you say, this is what we're all about, and then the only people that have to live by what you're all about are the frontline staff, it weakens your message. Do you think on nights and weekends, if you want to have a mediocre organization, you do that, and then people give 70% of their effort and they keep employed and you just get along, and that's what average is all about. If you want to give 100%, then you have to engage them in a bigger cause. You have to show them that they can make a difference. And you want to get people 120%, meaning, after work they're thinking about, boy, I'd like to recruit my sister to come here because she's brilliant and great and she can do all these things. Or I wonder how to solve this problem. That 120% takes a consistency of purpose, goals bigger than themselves, aiming for excellence, and a value set that they're not wondering how they're going to get treated. Everybody's going to get treated with the same set of values.
Yeah, you want them to be able to bring their whole self to that work. And in Agile, there's values or a principle of, we believe in a sustainable pace. So that means people are not doing the software thing where they're working 60, 80-hour weeks, or the death march of software. And we value technical excellence. And in organizations say, well, we're Agile, but we aren't technically excellent, or we have these death marches. Well, then that's not very Agile, and it's time to go back and really inspect your alignment with those. And you had alluded to in the book a covenant that you used with your teams or your staff to help with that alignment. Is that correct?
Yep. Yeah, we used we called it a compact. It was the same kind of thing. It wasn't a signed document. It was, in fact, a document that was given to you if you went to apply for a job. We'd send you this and say, this is how we live. Is that okay? If it's not, don't fill out your application, waste the time. And then when you'd come for your interview, we'd show it to you again and say, look, here's what we expect from you. Here's what the organization will deliver to you. You good with that? And then if they got the job, then they would get a note from me saying, here's what we're all about. Here's where we're heading. Here's where we're going. And here's how we're going to treat everyone. That doesn't mean this is how the senior people are going to treat the senior people and then different. It's how we're going to treat everybody. And so it became, and then at your first evaluation here, oddly enough, here would be the same principle showing up on the same thing. So when you had this repetition, here's how we're going to live, and you made it public. Here's how all of us are going to live. Now, is there always some people say, well, I don't like Dan Neumann, so I'm gonna nail him on this piece of the. There's always some hunting of your. I mean, you got 7,000 people. Everybody's not perfect. I'm not implying this made it everybody perfect, but what it did do is set a standard, and then you had to require discipline. And sometimes the discipline was very hard. I mean, the discipline was super hard. You'd have someone that was amazingly good in some area. In the book, there's a story of a young neurosurgeon who came, and quality was great. He was great, and he was on time, and he was fast, and he could see a lot of patients, and all that was great. And he calls me up one morning and said, Jeff, I think I'm in trouble. I said, why would you be in trouble? He says, well, I hollered at a security guard for putting a ticket on my car. Where was your car? Well, it was parked in a fire lane right by a building. I said, it's a fire lane. He said, well, I was going to come out if the fire alarm rang. I said, I don't think that's how it works. You got to not park in a fire lane, for Pete's sake, man. And he said, well, I know, but the guy. I said, why were you hollering at him? He said, well, it ticked me off. I said, well, the ticket doesn't cost you any money. Not that he couldn't afford it, of course, but it doesn't cost you any money. It just reminds you to park someplace different. What'd you say to this man? He said, well, I told him you should get a job that's useful, and I make more money in a week than he does in months. And then I didn't say anything. I just let that sit for a minute. He says, "You going to fire me?" So now you have a fork in the road, right? So you have this person that's very valuable to the organization, hard to recruit, does some amazing things, and yet he's behaving outside the lines. He's behaving in a way that is not consistent. And so what do? You fire him, or you just let it pass, or what do you do? So I said, it depends on what you do. If you apologize to this man, if you write a note to his supervisor apologizing for this behavior, which of course it's 20 minutes, so it's all over the organization, and then you enter a program to behave better, treat people better, then we can make a run at this. We'd love to have you stay. You're doing great work in many other areas, but I can't have you destroying a nurse, for example, at 7:30 in the morning, and then have her make mistakes on patients for 11 and a half hours, because we know that's what happens. And so we won't let that happen. So you're going to, and his reply was, I put $5 million on the books last year. Well, that's the reality. He's absolutely right. He did. He's a hard worker. Did a lot of work. Important member of the whole team. And I said, I'm going to miss that $5 million, but you cannot continue to behave this way, because if I allow you to behave this way, then I'll lose another doc, another surgeon, another nurse, another patient. It's just not okay. So if it's not okay for anybody, it's got to be not okay for everybody. And so it's just not okay. And he was unwilling to develop a plan to manage his behavior. And so he had to sell his house, left the community, and moved to another state. I felt badly for him and his family. But the truth is, I could not allow that. So it's a matter of discipline. So it's courage to say what you're about. It's discipline to follow through, and then durability to take the beating afterwards. Because, oh man, was the department happy? The department wasn't happy, and I felt badly for his family, and it was not good. and then we had to recruit, and it cost us some short-term money. So short-term thinking would have been easier just to let this pass and wag my finger at him and say, don't do that, knowing full well he would again. Long-term thinking says, for the good of the organization, broadly, if you don't manage these problems, then you'll lose other good people who are unwilling to put up with it. And they might not complain, they might not have the power to change it, but you're going to lose those people. Or you'll have people making mistakes, or you have people who have brilliant ideas that are unwilling to put them forward because they'll get afraid of ridicule by a bully. So managing influential people's bad behavior is a great opportunity in most organizations. Few organizations have really nailed that. It's a great opportunity to improve the overall creativity, engagement, decrease turnover. It's a great place for organizations to say, here's how we can get better.
Have a topic you want us to tackle? Send an email to podcast@agilethought.com or tweet it with the hashtag AgileThoughtPodcast.
And what I really like about that story and the way it's relayed in the book as well is there's the concept of a fool's choice. You either fire him or you don't fire him. But what I like is that you were able to come up with, here's a framework by which you keep the values. You apologize to the person directly, you write a letter, you go forth and sin no more, effectively. And now there is a way for that person to stay in the organization and align with the values, or they can choose not to be. So you've created at least a third option besides the fire him or don't fire him. And I really liked that part of the anecdote that you relayed.
I think our job is to try and help people be successful. I mean, my first hire was the vice president of HR because she was a people builder, not a rules police. Now, it's not like we don't have rules. Of course, we have to have rules, and there's laws, and we follow the laws, and that's important work. But the emphasis, it's just like the finances. The laws are just a tool. It isn't the end-all and be-all. The end-all and be-all for the Human Resources Department would be people builders. That's their job. Build people. Figure out ways that people can succeed. That was their responsibility. Do we have to follow the laws? Yes. Just like the finances. Do we have to hit our financial marks? Do we have to stay solvent? Do we have to pay our people? I want to pay our people. They deserve to be paid. I'm fine with that. But it isn't the goal of the organization is to pay people. The goal of the organization is to improve the well-being of the community. And I think another piece that senior leaders sometimes don't get is that once you get this going, it can go on its own. I mean, it's people innovate in the middle of the night on weekends when you're not standing there looking at them. One Friday, here's that kind of downer story. Here's a better one. One Friday, I was gone. I was off speaking someplace, and the two senior vice presidents, one was on vacation, one was someplace else. They weren't around, and right after lunch, a radiation oncologist, Dr. Pat Conway, walked into administrative area, and we had an open suite area, so no offices except for HR, and the goal was everybody who had an issue, it was everybody's issue. So no lines and boxes. If somebody had a problem, all of our jobs was to solve it. Whether you're an executive assistant or the CEO, you solve problems. We solve people's problems. So he walked in and he was looking for the vice president that was responsible for his team, and another one stood up. Brian Erdman, wasn't a doc, was an administrative guy, responsible for a whole different area. He said, "Can I help you, Dr. Conway?" And Pat says, "No, I was looking for my medical vice president." And he says, "Well, maybe I can help." He says, "No, you won't be able to help." Brian says, I might be able to help. I'd like to try." Conway says, "No, this is crazy. I'll just come back another day." Brian says, "I do crazy. Tell me." Pat says, "Well, I'm treating this guy today for this cancer in his neck, and I'm trying to come up with all these complicated things. It's very complex cancer, and it's spread all over his body, and I'm giving him radiation to try and make him comfortable, and he doesn't pay any attention. He's not paying any attention. He's there with his girlfriend. They're neither paying attention." Finally, I say, "This is your life. I'm trying to pay attention. I mean, I need to figure out what you want." And the guy says, I want to get married. What? I want to get married. That's what I want. You ask me what I want? I want to get married. We're talking about your treatment thing here. He says, yeah, but you asked me what I want. What I want is I want to get married. When do you want to get married? Well, today would be good. What do you mean today? I'm an oncology doc. What do you mean today? So that's what I really want. You want to know what I want? I want to get married today. So he had to go get some treatment. The doctor was going to see him a little later. And so he came up to the thing. And Erdman, having no idea what he was going to do, said, we can do that. Why did he say that? Because we're going to make more money on it? Because we're going to get some award? We're going to get any award? He said it because this is our principle. Our principle is to take care of people. Principle is to find out what they want. Our principle is excellence, not mediocrity. Mediocrity says, well, that's nice. I hope someday they get married. You give them a pat on the head. Excellence? Excellence is saying, we're going to get this done. So he calls the chaplaincy and say, how do you get these people married? How do you, well, we have to get a wedding. He said, where do they live? Well, that's in a different state. Somebody has to drive to Minnesota and get a marriage license. Where's their dress at? So how can you get somebody? Where are we going to do it? Cake, video, blah, blah, blah. In 2.5 hours, we had the whole kitchen organized 3 cakes and had cakes there for everybody at the thing. All the flowers left the gift shop with no clarity on who's going to pay for them, but they all went to the wedding. Some lady from the foundation knows how to play piano. She came and played piano. A lady out of CT sings at weddings. She sang. The media people showed up. Our own internal media people showed up. We had 2 videographers and 2 camera people taking pictures. Somebody drove 50 miles north to get her wedding dress and bring her wedding dress back. In 2.5 hours, we had a full staged wedding in the garden area of our hospital, and these people got married. Did everybody know the guy was going to die in a few months? Of course they did. Did anybody care? They didn't care. They didn't care. This was the right thing to do for these people. The important piece of all this, many important pieces. Did anybody call me? They call the senior vice president. They call anybody. They call the chief financial officer. They didn't call anybody. They just said, no, this is the right thing to do. We just do the right thing. What we do is the right thing. And so they married these people. They had nurses. Everybody was crying. It was great. Did he eventually die in 4 or 5 months? Of course he did. We knew all that. But that wasn't important. What was important is people were able to act because they knew the values of the organization. They weren't going to get criticized because they spent some money from the floor shop or the cake or took some people's time to do this. This is the right thing to do. This is what excellence was. This is what respect. This is what compassion. It was all the values. So once you set these values up and you show that senior people, mid-level people, everybody can live by these, then people act on their own. Then they can innovate on their own. They can solve problems on their own. It doesn't have to all boil up to the CEO or the senior vice presidents. Now you've unleashed the talents of the 7,000, not just 3 or 5 or 10. Well, I'll take the 7,000 against any 3 or 5 or 10 any day. They're gonna do.
Yeah, for me, a lot of organizations, it's you ask for forgiveness, or you. It's better to ask for forgiveness than ask for permission. And I think what you've done is create another option for setting up a framework where people can do the right thing.
I think one of the things that organizations worry about is when they put structure in, that they may limit innovation or creativity. And my contention is the ways you encourage innovation is that you have a certain amount of structure that allows people the freedom to act on their own. So if the structure is, here's our purpose, here's our goals, we're going to be excellent, we're going to exceed, we're going to go after the highest calling, and then you have a set of principles on which you go towards that with, here's our values, here's the principles on how we're going to behave and treat each other. That is how you get excellence, and that's how you get momentum, and that's how you get creativity in your people. I mean, you have to have a culture that, has some disregard for conventional wisdom, of course. But the structure can really add to the creativity by allowing people to know, here's how I'm going to be treated, here's where the fences are, and now I can run freely within those fences. And given that, our breast center became the first breast center of excellence in the country, much quicker than Hopkins or Stanford, other great places, but we had better outcomes because the staff was acting on our own. Our environmental people pushed our greenhouse gases down 95% in 8 years. We were invited to the Paris climate talks because of what we had accomplished because of this clarity on where we're going, and then unleashing the creativity of staff across many, many departments in our organization. So if you take the purpose and your values as your cornerstones, you build a code of conduct around how you're going to behave. You evaluate and manage your leaders around that, consistent across the organization. Then you can get momentum in many different departments. And then you have a progression towards excellence rather than kind of hovering in mediocre.
And that framework is one of the things you took that framework that you were using to manage people and align them and allow them that autonomy to act within that boundary. And so I like that part of the book too, where within each chapter, then there's some specific takeaways and allowing people to take action based on your experiences and the learnings you've had over the time. So I really want to appreciate you, Dr. Jeff Thompson, again. And the book is Lead True, and would really encourage folks to pick that up. And again, really appreciated running into you and having the chance to have you join on the podcast. Thank you very much.
Well, thank you very much. It's delightful talking to you, and good luck with your company. If I can help again, I'd be happy to do that with a podcast or with the group. So thanks for chatting with me, Dan. We'll talk to you again soon.
This has been the Agile Coaches Corner podcast, brought to you by Agile Thought. Get the show notes and other helpful tips from this episode and other episodes at agilethought.com/podcast.